Hello, my name is Heejin Mun. I am an MPH student at the University of Nevada, Las Vegas. I am also intern for the Substance Use Prevention and Treatment Agency within the Nevada Division of Public and Behavioral Health. My project was to create the cannabis data dashboard. First, I wanted to acknowledge and thank my preceptor Kim and biostatistician Devin in the Department of Health and Human Services for giving me this opportunity to work with them on my internship project. I also want to thank the Western Region Public Health Training Center for the scholarship and all other people who helped us to make this dashboard project work. Cannabis in Nevada became legal for recreational use on January 1, 2017. After that, cannabis use has been increasing among young adults in Nevada. This project is to develop cannabis data visualization for public health surveillance. It is to educate communities and stakeholders about the impact of cannabis and ensure public health safety through local and statewide collaboration efforts. Background of the agent. The Nevada Department of Health and Human Services supports the health and well-being of its residents by providing a wide background of the agent. The Nevada Department of Health and Human Services supports the health and well-being of its residents by providing a wide range of essential services to ensure families are strengthened, public health is protected, and individuals achieve their highest level of self-sufficiency. This is the methodology of the internship project. First, we identify and interpret cannabis-related data and import it into Power BI dashboard creation tool. And we provide a completed dashboard to the Division of Public and Behavioral Health for the review and Office of Analytic Public website. And we meet with the Council for State and Territorial Epidemiologists on data visualization, and we present the dashboard to coalition partners. To create the dashboard, we retrieved cannabis data from various sites. First, it's Poison Center. Poison Center data. For the Poison Center data, these are the criteria. For the Poison Center data, these are the criteria we use to pull up the cannabis-related data. And this is the graph that I think the most important for the Cannabis Poison Center data. And this is the graph that I think the most important from the Poison Center dashboard. This line graph is showing the monthly trend of cannabis-related calls from 2017 to 2020. As you can see on the graph, the most cannabis-related calls are made in March, July to August. As you can see on the graph, the most cannabis-related calls are made in March, July to October, and it declined a little bit in November and increased again in December. We also retrieved data from the vital record to figure out the relationship between pregnancy and cannabis use. As you can see on the graph, this is the graph of birth weight group by drug type. As you can see on the graph, the most number of cases are from marijuana and cannabis use for both groups, which are very low, and normal birth weights. For wire BSS, BRFSS, these are the criteria we use to create the dashboard. And this is graph from BRFSS, and this graph is from BRFSS dashboard page. It is showing the reported marijuana use by county, group, and year. As you can see on the line graph, the number of cannabis use is increasing every year. Especially it increased drastically between 2017 to 2018 in rural counties. It is because marijuana got legalized in 2017 in Nevada. Conclusion. This is the conclusion. On January 1st, 2017, recreational cannabis use became legal in Nevada. After that, cannabis use has been increasing among Nevada's young adults. To anticipate further complications and major risk factors, it is critical to develop data visualization tool dashboard associated with the cannabis use. The cannabis use data was created to provide access to public. That's why the cannabis use data dashboard was created to provide accessible public health surveillance information on cannabis data and public health impacts of cannabis legalization for Nevada residents. Thank you.